Hello everyone, welcome back to my channel Physiology Open. In this video, we will continue with our pharmacokinetics series. That is, today we will talk about bioavailability. So, bioavailability in simple terms is rate and extent of drug absorption when given by a particular route. Okay, and an easier definition is fraction of the drug absorbed to the plasma when it is given by a particular route. Okay, so fraction means, how we will calculate fraction means, that is the amount of drug which enters into the plasma and it is divided by the amount which is given. So what is the original dose? That will be the fraction. Right? Now, your books generally give this rate and extent of drug absorption. I found this particular definition as more fundamental, very clear. Fraction of the drug which is absorbed, it is the bioavailability. Now, why do you want to study about bioavailability? So, simple, if we know this definition, that fraction of the drug absorbed, so we need to find out what should be our mechanism of giving the drug. That means what should be the route of administration, what should be the dose, what should be the dosing interval. It is determined by bioavailability. Dosing interval is also determined by other mechanisms as well. So, we will bring this concept again later when we have already talked about distribution, metabolism, so as to determine the dosing interval. But this concept will tell you ultimately that what route of administration you will use and how much dose you will use. Okay, so this bioavailability is determined by using a graph. Here, x-axis shows the t, that is the time duration, and y-axis tells about the concentration of the drug in plasma. Okay, concentration, not the amount. See, when we are talking about this fraction of drug absorbed, we are talking about amount. Okay, so this we are going to determine indirectly by this particular graph, because you see, amount we cannot determine how much amount has gone into the plasma. We can only take a sample from the plasma and determine the concentration of the drug. Okay. So what we do after administering the drug, say suppose orally we have given a drug at time 0, then in some time interval, say suppose after 30 minutes or every 1 hour, we take a sample of the plasma and determine the drug concentration. So it will slowly rise if we have given orally. It will reach to a point which is maximum. It will stay there for some time and then it will come back. Okay, so why it is happening? Because as you give the drug, so here we have taken different samples, say every 1 hour. Okay, so here it is 1, 2, 3, 4, and the drug concentration is increasing. So we can plot it something like this. So why it is happening? I was talking that as you have given the drug, it will start getting absorbed. So its concentration is increasing. Then it will reach a maximum and then the concentration will start falling because body will start metabolizing it as well. Okay, so here what is happening, that the rate of absorption is more than the rate of the metabolism. Okay, or the excretion of the drug, we can say. Right? Here, rate of absorption becomes equal to the rate of metabolism. So, we get a steady state concentration, and here what we get is that the elimination of the drug, metabolism or elimination of the drug is more than the absorption of the drug, rate of the absorption of the drug, right? So that is why we get a fall in concentration and ultimately this drug is eliminated from the body or metabolized, right? Now, to determine bioavailability, we simply take this area under the curve, So you see, here it is telling bioavailability amount in plasma, amount by dose. Here, this area under the curve will only tell us indirectly about this component. Okay, if the drug is more bioavailable, then this graph will be different. It will be something like this. Okay, so that is why area under the curve will tell us about the bioavailability. Now, before that, there are certain terms we should know, that is Cmax, Tmax. What is Cmax? Cmax is the maximum concentration which is achieved when the drug is given. Okay, so this is Cmax. and Tmax is the time at which this maximum concentration is achieved. So you see the first definition which I told you, that the rate and extent of drug absorption. So this part, what is the rate of the drug absorption, that will be known by this time. That is the speed of drug absorption. If some drug is absorbed faster, then this graph will shift like this, okay, like this it will be, because the Cmax will be achieved in earlier time because a drug is absorbed at a faster rate, okay. So this rate is determined by Tmax. Cmax, there are many features by which it is determined, but right now we will concern us about the bioavailability only. So Cmax is the maximum concentration of the drug which is achieved in the plasma, right? Area under the curve, I told you, it will tell you about the bioavailability. So you have to take area at various places, add it all up. Now, to determine that which particular route you should choose, you should be able to compare bioavailability of one route versus the bioavailability of another route. So which route you will compare it with? We use for that the IV route, okay. So intravenous route, the bioavailability is 100%. 100%. This bioavailability is given by the letter F. F is the fraction of the drug absorbed, okay. So this is 100%. Why it is 100%? Because it is IV, you are giving it directly into the plasma. And what is the definition? Fraction of the drug absorbed in the plasma. So yes, you are giving directly in the blood vessel, so bioavailability is 100%. So if we see this graph for IV route, it will start from here, because at time 0 you have administered the drug, and the Cmax, the concentration which is achieved, is the maximum, right? So it will be here, the Cmax is maximum, bioavailability will be 100%, and it will decline slowly, because that will also be metabolized or eliminated, right? But for other routes, always it will rise and then it will decline. So to determine that which route you can use, you always compare it with the bioavailability with the IV route, right? So the method is, you compare bioavailability, say suppose IM route, divided by the area under the curve of bioavailability of the IV route, right? Similarly, you compare with other routes also. Area under the curve, maybe oral you want to compare how much it is with the IV route, because that is 100%. But you should know the area under the curve for comparison. Okay. Importance, I told you that it is used to choose that which route of administration, what is the dose you will choose for giving a particular drug. Now, there are various factors which affect this bioavailability, and some of these factors we have already discussed in our previous video on pharmacokinetics, where we talk about the drug transport mechanisms. So we discussed about the factors which affect the absorption of the drug from a particular site. So same factors will affect the bioavailability. If the absorption of the drug is faster and more, that means the bioavailability of the drug will be more, right? So I am not going to discuss everything in detail. You better watch that video as well, because there are many MCQs which are asked in this. Plus this in pharmacokinetics, drug absorption is a long question as well. So you should be able to write these factors affecting the bioavailability as well. Okay. So first is pH. Before I told you in the previous video that if a drug is lipid soluble, it can easily cross the membrane. And this pH of the medium determines whether the drug can be lipid soluble, because the drug can exist in ionized and non-ionized form. So if a particular drug is in the like medium, that means acidic drug is an acidic medium, then it mostly will be non-ionized. So that means that absorption will be more. Okay, that is pH. Then there is surface area. So say suppose acidic drug is there, and in stomach we know that acidic pH is there, and in the previous video I gave you example of aspirin. So yes, the absorption occurs in stomach because in the stomach it is more in non-ionized form. But for most drug, what happens that the surface area of the intestine is much more. In intestine, from our physiology, we know that villi and microvilli are present, which increase the surface area in the intestine. It is like this, right? And even the cells has lot of microvilli. So there is increased surface area. That means the drug will be in contact with this surface area everywhere here. Okay, so it will get more surface area for absorption. So that means even sometimes if the drug isn't ionized, whatever is there in the non-ionized form, it is much better absorbed in intestine. So sometimes because of this, if you see the absorption of the drug, it is much better in the intestine. But in diseases like malabsorption syndrome, say suppose there is destruction of this villus structure of the intestine, there are certain diseases like that, say suppose celiac is pro. In that case, the drug absorption will be lesser. So we have to think about the route of the drug administration in patients who are suffering from such kind of diseases as well. Then coming to food in stomach. Food in stomach decreases the rate of drug absorption, okay, decreases the rate, but there are exceptions as well. Also, it is a little bit complex. You see, for most of the drugs, it is told to the patient to take the drug after food. That is because if he is taking food in empty stomach, in that case, there is a lot of acid present in the stomach which can destroy the drug once it is taken. Okay, so generally it is told that take the drug after the food so that the drug is not destroyed, right? Although it is decreasing the rate of the absorption, but there are certain other drugs whose absorption increases after food. Okay, for example, there is an anti-malarial drug lumefantrine whose absorption increases after milk, okay, because it affects the lipid solubility of the drug. The next is the gastric motility. If the gastric emptying is faster, in that case, drug absorption increases, rate of drug absorption increases. Can you guess? See, here we have seen that the drug is better absorbed in intestine because of increased surface area. So, if gastric emptying is faster, that means the drug is going to reach to the intestine earlier and get absorbed earlier. Okay. Next is blood flow. Blood flow, say suppose if you have given a drug to a particular site and the blood flow there is lesser, in that case the drug entry into the blood will be lesser, rate will be lesser because the blood is not there. Blood should continuously move. Okay, so one example is subcutaneous and intramuscular route of administration. Subcutaneous rate of absorption is lesser compared to the intramuscular route of absorption, right? Then there is something called first pass metabolism. What is first pass metabolism? That when we take the drug orally, it goes into the blood. But blood from the stomach first goes into the liver. That is the portal circulation. That is a protective circulation which the body has, so that whatever foreign substances also are coming from the diet, they can be metabolized and removed. And this is happening with the drug as well, because when we are taking it is directly going to the liver and there it is getting metabolized. Now whatever drug which is left in the body after the metabolism, that causes this concentration of the drug. Okay, so that is first pass metabolism, and obviously it will apply only to the oral route, not to IV route, not to subcutaneous route, not to intramuscular route, right? So those are the factors which affect the bioavailability. Now, before ending, some terms just we should know that what is pharmaceutically equivalent and what is bioequivalence. Pharmaceutical equivalence and bioequivalence. So, pharmaceutical equivalence is when we have two different companies preparing the same drug and this drug has the same components in both of them. Okay, so whatever are the components, they are same in both the drugs prepared by two different companies. That is known as pharmaceutical equivalence. On the other hand, bioequivalence is about the bioavailability. So these two drugs when administered, and if they have the same bioequivalence, same bioavailability, then they are known as bioequivalents. Okay, so even though some drugs may be pharmaceutically equivalent, they may not be bioequivalents. So when we are talking about pharmaceutically equivalent, we are talking that two different preparations, they have the same dose, same route, same active ingredient, but still If their bioavailability is different, then they are not bioequivalents. Okay, so that was about the bioavailability. Thanks for watching the video. If you liked it, do press the like button, do share the video with your friends, and don't forget to subscribe to the channel Physiology Open.